Well, hello, everybody. Thank you for joining us for today's symposium and for the topic of our session this afternoon, how 2020 and COVID-19 have impacted the employees of healthcare providers and how we should respond. My name is Tom Jacobs. I'm the founder and CEO of MedHQ, and I'll be acting as sort of your moderator today. And first, I'd like to toss it over to Marianne Monroy, who will introduce herself.
Good morning, everybody. So my name is Marianne Monroy. I'm a partner director at Garfunkel Wild PC, and I spend the majority of my time focused on employment law. I'm the co-chair of the firm's employment law department, and I am a litigator as well as someone who provides HR day-to-day legal counseling in the employment law area. So we handle things ranging from federal lawsuits, state lawsuits, administrative complaints, policies, procedures, and a whole array of employment type of matters in the tri-state area. And I happen to be licensed in New York, New Jersey, and Connecticut. I won't bore you with too many details about myself, and I'll pass it along to the other speaker.
Good morning. My name is Rita Hernandez-Figi. I'm Chief Operating Officer here at MedHQ. I have about 40 years of human resource experience, and it's something that, of course, is a passionate topic, especially these days. And we look forward to participating in this panel discussion today.
All right, well, thank you both. So let's get started. As we all recall, March, April, and May, the federal government and many state governments enacted new laws, notably the FFCRA and the CARES Act. These laws, especially the FFCRA, established new provisions related to employee leave. But on top of that, there have been many other things that have happened throughout 2020, such as the social unrest over the summertime and most recently the election. So it's created just a unique environment, to say the least, during this year. We've heard from healthcare managers, a common sentiment is, I've worked in healthcare for all my career, and I have never navigated something as unusual and as stressful as this year. So start off with, Rita, what do you hear from managers? Can you talk about some specifics about how the COVID-19 pandemic and the other things that have gone on in 2020 have impacted healthcare managers?
It's something that is very different for each person. And I think that's probably the toughest part of this, is that there's no one answer or one solution for each group. Every administrator, depending on the state they're in, how long they were closed, face different challenges throughout the year. And it does feel like a very long year, even though this all started in March and we're in November. But I think the biggest thing is, how do we accommodate my employees? We have a need to do business. We have a need to accommodate different schedules. We have employees who are worried about the pandemic. We have employees worried about social justice. And so it's created this really stressful situation for everyone. And I think that's the topic that you hear. Each person that calls is calling with something slightly different. But when you boil it all down to it, really centers around the fact that we are in these very unusual, uncharted times. And, how do you help people navigate through this? And I think the thing that people really need to remember is to listen to each other. People sometimes just need to vent, need to talk. We understand as business professionals that work needs to get done, but you need your employees also to get that work done. So it's just trying to be as practical as possible. And of course, the introduction of different laws and different practices has also complicated the issue a bit. So we spend a lot of time counseling on the various leave laws as well. Who's eligible for what, when, where? And that's what we spend a lot of time on right now.
Thanks, Rita. Marianne, in your law practice, I'm sure you've seen firsthand some situations that have developed into serious employment matters. Can you give us a scenario or two that kind of describe, maybe how some of these challenges that would be, hard to deal with in any year, but just maybe the frequency and the I don't know, the depth and breadth of them this year especially have created this environment. Have you seen some of these things, really escalate and maybe you can give an example or two of that and how that's been treated and handled by your practice.
Sure, sure. And as Rita said, it's really unprecedented times. We're dealing with a host of different issues kind of colliding all at once, right? So you have all the typical employment issues that come up in the normal course, but you compound that with COVID atmosphere and issues related to COVID, the schools closing, just trying to get people back to work. And so we've seen a very large influx in calls related to the return to work discussion because, businesses, most were closed for a while or working in very limited hours. And, now we get, well, I can't get my staff back to work. How do I operate if I can't get the staff back to work? And then we have a lot of calls about employees submitting requests for disability accommodations or leave requests. And that's where I know we're going to focus a little bit of this program on looking at the laws surrounding disabilities as well as leave requests and trying to navigate that. Now, the laws are constantly changing. I mean, most recently, New York State adopted a paid sick leave law, in addition to the COVID emergency paid sick leave law, which we'll go over. So what we see sometimes, we've had employees who have been out for several months, maybe telecommuting, working from home, and all of a sudden now you're trying to bring your work staff back, and you can't be dismissive about the employee who's raising disability or other types of concerns. And how do you handle that? How do you deal with that to avoid the problem? Because if they've already proven they can do it from home for the last 3 months, you then have a little bit of a dilemma in establishing why you need to have that employee come back in the face of them saying, I have a disability issue. Couple that with telecommuting restrictions or limitations, right? You need your telecommuting policies. How are they managed? We see issues regarding how do we deal with efficiency. People working from home, I don't know if they're sitting at the beach or they're actually doing what I need to get done, right? So equipment issues have come up. So these are the types of things that we're seeing, and all of us on this call have advised clients on how do I deal with that? How do I make myself compliant with regard to allowing people remote work and do it in a non-discriminatory fashion too. So I'll turn it back over to Tom so that we don't go too off on a tangent. I could talk about this subject all day, but Tom, you can direct us as far as what you would like us to talk about next.
Well, you raised an interesting point there, or two, maybe actually a few very interesting points, but something that healthcare maybe hasn't dealt with as much as other industries is the remote worker. So much of healthcare is inside the facility, inside the physician practice. Yet today, employers in all industries are trying to accommodate employees as much as they can and reasonably so they can still get the job done, as Rita mentioned earlier. But now healthcare owners of businesses need to handle this remote work situation. Can you talk a little bit about, have there been any specific, employment law changes that have, like how does the FFCRA and employee sick leave or employee paid medical leave, how does that impact maybe some of these situations? Can you talk a little bit about that, Marianne?
Sure. And so let me just back up for a second and just make sure everybody is aware that really when these things come up, there are a number of laws that you want to just check off in your head that, okay, I thought about this law, right, before you take the next step. And whether you speak to your HR director or your outside counsel, but with every disability leave request or accommodation request or just navigating the workforce, you want to make sure you're not running afoul of different laws such as the Family and Medical Leave Act. You got the Americans with Disabilities Act. Those are two federal laws that deal with disability and leave requirements. But New York City, New York State, Connecticut, New Jersey, they all have their own state parallel type of law that provide protections for individuals with disabilities and leaves. So those are things you want to make sure you check off the boxes. And it's not just related to disability and leave. You want to make sure you're implementing your policies in a non-discriminatory fashion with respect to all of the protected categories, whether it's race or gender or national origin. So when you're talking about, all right, we're going to let these 6 people Zoom, right, and do some of their work remotely, if you look at it, is it being done in a non-discriminatory fashion? Are you providing accommodations in a non-discriminatory fashion? Not that, okay, well, these people, I think they're superstar workers, I'll let them Zoom from home because I trust them. But it happens to be that they are the 3 white men versus the other people who have requested, we're not going to allow them to do it because we just don't think they'll be as efficient and we don't trust their productivity working from home. Those are issues that we have been confronted with. And when I ask the client, I'm like, well, what's the job title the person has? It's X. And have you let other people in that job title telecommute or do Zoom instead of, let's say, direct patient care? I see this with mental health therapy sessions, social workers, and they tell me yes. I'm like, okay. And they're in the same position as the other person who's made the request? Yes, they are. And they've been here for the same amount. So you go through the litany of questions, and then at the end, when I'm asking them, well, why do you not want to let, Sally Joe do it, but you let Michael whomever do it? And the reason is, well, I just don't think that they're going to do what they need to. That's not going to work. You have to have objective criteria to look at. So, keeping all those disability laws in mind, the other things that we should also keep track of are the leave laws. And I'm sure, Tom and Rita, you have come across these as well. The FFCRA is the big one, right? We've all probably have listened to 1 or 2 programs on the FFCRA, so I'm not going to bore you with too much of that. But certainly when people are asking for time off because they have a health condition or related to COVID, you have to consider that. You have to consider if that applies. And you have different components to that law with regard to sick leave, where you can get up to 80 hours, as well as the extended family medical leave component related to, child care type of issues. The newest development, or one of the newer developments with FFCRA that I'll point out, when the law first passed, a lot of people took the option in the healthcare field to exempt themselves out as healthcare providers. In New York, in particular, and now the feds as well, they've narrowed that exemption. So if you were a healthcare provider, you could have, in the beginning, opted out of providing FFCRA leave. You still had to put the poster up, but then you did another notice and said, as a healthcare provider, I'm not providing that leave. That has since changed. There were some legal challenges, and now who can be exempted out is really limited to the nurses, the doctors, the direct care providers, and there's a number of those that are spelled out, the type of provider. But the days of saying, okay, the billers in the back, the HR, the financial people, those are no longer covered by that exemption. So that's certainly something we've come across, and we would tell you, take a look. If you are still exempting yourself out as a whole, you probably need to rein that back in a little bit. FFCRA can run concurrently with some of the state emergency leave statutes. Like, for instance, New York State has a COVID emergency sick leave statute. It doesn't mean that you get 80 hours under the federal law and another 14 days under the state law. You just can't get less than them combined. So if the state has something more generous, you have to get at least that much. And then you also have to look at the paid family leave laws. So sometimes after you exhaust a certain amount of benefits, you may still be able to get, for instance, New York State has a paid family leave law, some amount of benefit under that law for an ongoing COVID-related need. And last but not least, you look at, actually not last but not second to last, you have just your typical state sick leave laws, right? So some states in New York City and now New York State has a paid sick leave law. So that's not the emergency COVID sick leave law. That is like a new policy, that's like hot off the presses from September. And a lot of our clients are now grappling with that piece too, because it doesn't quite track New York City. So if you're a New York City employer, now you have this New York State law, which is more generous than the New York City sick leave law. So by way of background, New York City generally gives 40 hours of paid sick leave, 1 hour for every 30 hours worked. However, the state has now, depending on your size, you can accrue up to 56 hours of paid sick leave. So there's a little bit of a difference. There haven't been regulations really issued yet on how these things are going to interplay, but you do need to be mindful of those. And I'll also preview for you, if you haven't really focused in on it, there is a carryover component. The laws have not yet specified whether or not you can eliminate that carryover component by front loading. I don't want to get too technical with that law, but it's something I want to red flag for you that you need to be looking at, both from the COVID arena as well as the non-COVID, because we do think that that's a hot area and potential litigation may come up.
So Marianne, you've pardon me, I'm sorry,
yeah.
One more thing? Well, I was going to say,
remember the employees also have paid sick leave or paid PTO, paid time off banks. So that is stuff you also need to look at. And yes, Tom, cut me off anytime you want to. I tend to talk a lot.
No, it's this is what people want to know, I think.
Right.
And that kind of leads me to my next question for Rita is, Rita, as you know, Marianne just went through a litany of recent changes. I mean, some were, so long ago is like 6 months ago.
Right.
Massive changes. Others more recently, like Marianne said, in September, and things just continue to change in terms of the rules and regulations that healthcare managers need to follow. Can you talk a little bit about how, what should a healthcare manager do, and what, from making sure their employee handbook is updated to everything else, what can they do?
I think the biggest thing is contact a professional, contact somebody in human resources, contact your legal counsel, because this is complicated. And one of the points that Marianne made, and I wanted to talk about a little bit, is this the healthcare exemption. So it was easy in some ways for administrators to say, okay, we're exempt. We're not going to do this. And now you have a split population. And that in itself has caused a little bit of consternation at the administrator level. Now I have a group of employees who I say, you are not eligible. We're the healthcare exemption. This affects nurses. And then you have the office personnel that is eligible. And, there are sometimes some complaints about fairness and the like. And I think, again, I go back to communicating why things are the way they are. Healthcare professionals do have to be on site. And, there is a difference in between the work that people do. And I think you have to have a consistent story. So my advice to managers is to look at these things, look at what each and every individual does. If you have a group of nurses, if you have billers, you have bookkeepers, whatever the case may be, you really have to spend some time not only looking at it over the top, but then spending time with the individuals and making sure that, as Marianne said, that you're checking all the boxes. Is there PTO available? Is there some scheduling modification you can make for your healthcare staff? Because at the end of the day, while they're providing healthcare, they also have families. So it doesn't hurt to try to accommodate a little bit of that, whether it's variable scheduling or so we go through just the whole process. What can you do and what can you do consistently? So if you're not going by the letter of the rule that says this is how you do it, and you decide that, okay, I want to provide some accommodation for folks that maybe aren't covered, once you make that decision, that you need to make sure that you stay consistent, that, this is ongoing. You're not going to do it for this person and not for that person. But again, for us, it's all about the conversations with the centers that talk about individuals and their needs. And the question that we're getting a lot is on children with remote learning. And how do we accommodate schedules where kids are uncertain whether they're going to be back in the classroom, not in the classroom, here in Illinois, where that rule has changed multiple times, where employees get ready to go back to work, back to a regular schedule. And then, the schools remain closed. An announcement is made that schools are going to be back in session. Nope, we're still going to continue doing remote learning, and understanding that it's not just a frustration for the center, but also frustration for the employees. No one likes this uncertainty, and it's keeping the dialogue open, just talking about it, but documenting too. You have to document each and every time, not only for the individual, but for your own peace of mind, so you understand what you've done in the past, because this is fast paced, this is fast moving, and the changes are happening on such a speedy time schedule. What used to be okay 2 months ago is no longer okay. Now you have something else to take a look at. So it's that ongoing keeping on top of the changes in the rules and everything else that's going on, but also being compassionate.
That's I'm going to shift a little bit or pivot just slightly. I remember in the early days of the pandemic when surgery centers were being told you need to shut down and suspend all but maybe the most urgent cases. A lot of the staff, a lot of the country had an opportunity to kind of be at home, still getting some compensation perhaps, but it was that healthcare manager that was still showing up every day, juggling like 13 different things at a time and trying to keep in touch with everybody that was wondering what's happening. Healthcare manager themselves oftentimes just learning on the fly, trying to understand what's happening. But all this has really, I think, been a very heavy burden on the managers especially. Rita, can you talk a little bit about, that impact and maybe what resources employers might want to make available, or what resources might be available for employees and managers especially, whether it be, benefit programs, EAP, or even also keeping up with the educational end of things. How do people keep abreast of all these rapid changing rules, and how do they, day to day, I'm talking on the front lines, really make sure that they're covering the bases they need to cover from a training point of view?
I think one of the most important things is review all your benefit plans. What is it that you offer? What is it that's available? One of the greatest things that has come of this is more wider acceptance of telehealth services. And I tell everyone to avail themselves. There is no harm in making a phone call. You're feeling pulled in a million different directions. You need to take care of yourself too. And if you don't take care of yourself as an individual, as a leader, it's tough to help everybody else. And it's also easy on the same token to be that leader that says, I'll take it all on and I'm not going to take care of myself. But as you're looking at these services for your employees, whether it's telehealth, whether it's your employee assistance program or the like, but reach out for help, reach out to talk to someone. A lot of people are in the same boat, and sometimes talking really helps. I always recommend for managers, give us a call. We can walk through these scenarios with you, but sometimes you just need to bounce ideas off of each other. And I think that goes a long ways too, to not feel so isolated in all this plethora of decision making that we have found ourselves in, because it's decision after decision, choice after choice, day in and day out. It's an interesting time.
Absolutely. You said a couple things there. The telehealth resource now, as you mentioned, is more accepted. The commercial payers are paying for it. They have programs, but those telehealth resources, oftentimes one of the big uses is the mental health aspect, or just some emotional support maybe, and maybe it's making that one phone call that kind of relieves some pressure that can be really, really helpful. But also in that same regard, having your team of advisors that maybe those folks like an HR resources, like MedHQ is an HR resource for many healthcare businesses, or Marianne in the law firm. I mean, an advisor like that who's not inside your organization that you can talk to in a trusted relationship that can really, give you an opportunity as a manager to, you may call it venting, but we also might just call it, I need some other set of ears and eyes to listen to what I'm thinking about and what's going on in my organization, and getting just some objective feedback. So
right. And one more thing about the telehealth services, you mentioned mental health. One of the beauties of telehealth services now is that you can get that service at any time. you can schedule something in the middle of the day. You can close your door for, 15 or 20 minutes and have that resource available to you right now because you can schedule these things. And it doesn't have to wait until night where you can talk, or when you can go visit a doctor's office. Telehealth has really come a long way. And I know the EAP has offered that service, for a very long time. You can talk to somebody on the phone. But I think as this becomes more widely accepted, I highly encourage people to reach out.
And Marianne, you were going to say.
So yes, and I agree with everything both of you have said, but there's another component I like to point out from a legal standpoint, that while all these programs are available, employees should be encouraged to use them, reach out. I'm also very leery about the employer who makes assumptions about employees, okay? And they might see some performance issues, and they assume the employee may have a mental health disorder, or maybe some kind of health condition. Maybe they're assuming they're starting dementia, whatever it might be. Then what happens is, under the disability laws, even if they don't have any of those conditions the employer has assumed them to have, they are cloaked with a protected category, a perceived disability. So I am very careful about addressing performance issues on the assumption that, oh, maybe there's something wrong with them, and let me send them to EAP because I think that they have, some kind of obsessive compulsive disorder or whatever it might be, right? So I suggest a lot of times when you see performance issues, you sit down with the employee, you address the performance issues, and give them a platform to raise something that may be affecting their ability to perform that job properly, rather than saying, is the reason you can't do that job because you're suffering from X, and you know what, you should go see Dr. So-and-so. So you just have to walk the line. I think there's a huge value in offering this. I think there's a huge value. A lot of our clients are doing, for lack of a better word, like almost like a town hall meeting, acknowledging the stress people are under, acknowledging them for coming together and rising to the occasion to handle all these really pressing needs of the patients and the communities during COVID, but at the same time walking that line without classifying your whole staff as disabled and having to work around that.
No, and that's a good point that you raised. When we're speaking to our administrators, we tend to send a lot of information out about the benefits that are available. But we also let our administrators know that sometimes they're not the mental health professional. And so a lot of times employees want to come to them with all of their problems, and it's really an opportunity there to let your employees know we have other resources for that. We're here to speak either about your performance or about your schedule or whatever else. You want to be compassionate, but you also want to make sure that you're not that mental health provider to your employee.
Absolutely. We always want to manage our, the job, manage maybe the company, maybe the organization has a set of organizational values, but even those are always, or should always be written in terms of what are the actions and behaviors that demonstrate those values. It's not subjective. It's not, nobody's trying to be nobody should try to be that mental health professional that, that they're not trained to be. Absolutely. Right. So that's an excellent point. Thank you for pointing that out, Marianne. But this, some of the other challenges going on in this interesting year, the social unrest issue, and so some organizations are looking at, a new acronym we've all learned, and a very important area, DE&I, so diversity, equity, and inclusion. Rita, can you kind of maybe define that area? What does that mean, and what do organizations mean by DE&I? And how do you set the table for that discussion?
So, diversity and inclusion have always been part of every organizational culture. It should be. The equity piece is the portion that I think is probably getting more attention right now. And that's really, you can be diverse and you can include people, but if you don't create the equity amongst your employees, amongst the needs of your employees, you're not looking at it full spectrum. So yes, it's okay to say we're a diverse organization, but what are you doing to both include your employees in a process, and how do you bring equity to a situation? So not everybody's starting from the same platform or the same level of advantage. So you need to make sure that you provide opportunities for everyone to interact and to have experiences, whether it's now helping plan something for the center, planning policies or things that you want to live by and do, but including your employees and giving them a voice in what happens. What is it that is important to you as employees? And there's where the equity starts to be a part of it, because it's not going to be the same as I'm inviting you to a meeting, I'm including you, but what am I doing to make sure that you're heard? And that's the equity portion of it.
One area that seems to be specifically related in the employment law arena, and Marianne, maybe you can comment on what I'm about to say here. I don't want to go too far afield, but the ADA, the Americans with Disabilities Act, in some form, that reasonable accommodation concept seems to be a part of what we mean when we say equity. I mean, what we're really doing is we're accommodating somebody who should be accommodated by law reasonably, as an employer can reasonably do in that, given the size, given the scope, et cetera, for a person who has a need. What do you think, Marianne? Is that a reasonable way to think about this?
It's an interesting point. I hadn't thought about it in the disability category, but absolutely. It's one of those things where people who maybe traditionally wouldn't have applied for a job because they weren't aware that they can get an accommodation that will allow them to do it. Absolutely. I know, even in my own firm, we've had people who have been hearing impaired or, deaf, and you can get modifications of equipment so that there can be that communication. And maybe in the past, if you asked 20 years ago, I might have said, well, how is that going to happen? But you can absolutely make accommodations so that people can perform certain jobs that maybe in the past they typically would not have even tried to apply for. So I think that's a great point, Tom.
Well, good. And I think when hiring and recruiting, Rita, I'm sure you can talk about some of the ways that employers really have traditionally tried to create some, I'll call it equity, since that's the topic we're talking about. Rita, can you talk about that and how that may come to play in the filling a job?
Sure. So again, a few things about that topic. One of them is that look at where you're getting all of your employees, because if you want to create diversity amongst your workforce, you probably want to be careful of always getting all of your candidates from the same pool. And in the healthcare services, a lot of times employees come to your center through referrals, when there's no problem with that. But if your referral pool isn't wide enough, broad enough, are you bringing in individuals who are just like everybody else you've hired? In which case, maybe that's good, but is that really being inclusive, and is that creating equity? Or are you reaching out to some of the local schools or universities that maybe aren't part of your normal network to broaden that group of people that you're bringing in, and understanding that not everybody is at the same platform, but what about training and inclusion and providing opportunity, which I think is incredibly important. And you never know what somebody, even if it's from a different school, even a different recruiting source that you may use, but the pool of candidates that comes in, it doesn't always have to be just like Sally, who, I love her skill set, so I'm going to hire 10 Sallys. Well, you may be missing out on something. It's time to maybe hire Joe and look to see what benefits Joe can bring you to the workforce. So it's tough to do because usually when we're recruiting, everybody, what's the major goal? Let's get this filled today. But how about taking a step back and doing some planning and knowing where you're going to recruit your next candidates from and pulling together a list before the need is there. So we are asking our managers to take a look, what is it that you do for recruiting? How do you get your people? And while you're not in the in the mad crunch of needing someone, what can you do? Who can you reach out to bring in some additional candidates? And think about these other areas where, especially on the equity portion and the accommodation portion, there's a whole world of folks out there that are looking for work. And what can you do to make your workplace more inclusive, diverse, and provide that equity of opportunity?
Well, thank you for all that. And so I just want to touch on one more area that we haven't yet addressed, and that's OSHA, and kind of the new challenges for healthcare businesses there. And then we'll maybe wrap up with some, each of you can give some final comments or final thoughts. But so on the topic of OSHA, Marianne, have you seen some changes, or maybe in terms of maybe the laws, OSHA laws haven't specifically changed that much, but certainly COVID brings a new dimension of challenge for employers. And what are some risks that they need to be careful about, and how should they be thinking about managing those risks that are
Right.
newer and different maybe than a year ago?
Right. So, I mean, OSHA is definitely creeping up a lot more than we've seen in the past, particularly in the nursing home arena. But, OSHA does have a general duties clause in providing a safe workplace environment. So, the way you have your office set up right now and the protocols you have put in place to comply with the executive orders that are out there are important. Now, sometimes with the passage of time, I think that people start to get a little bit more lackadaisical, like, okay, we put out all the signs, and originally we were all always wearing our masks and stuff like that. I think from an OSHA standpoint, managers, administrators have to make sure that everybody is still complying with those requirements, because if and when someone gets sick, there will be contact tracing, and they'll be looking back to see, okay, where did that person likely contract COVID? In the healthcare arena, it's more likely to be an assumption that that the employee contracted it at the facility, okay? So you have reporting requirements now under OSHA for depends on the level, obviously. If there's a hospitalization or a death, there's a mandatory reporting requirement. But even from, a lesser standard where you bring in workers' comp too. If your employee, and I know that's a little off from what you're talking about, contracted or more likely than not contracted it at the facility, you have potential workers' comp reportings as well. And you have to be mindful of documenting, filling out the OSHA forms, the incident reports, and then doing your contact tracing to make sure that if you're called upon, you can say, look, we did all this, we made the right notifications to the staff, we took whatever cleaning protocols needed to be happen, we sent people home, we did the quarantines, because OSHA is looking at that. Amongst other things they're looking at, and I'm sorry, I tend to talk a lot, the PPE, they're going, if they come in and do an audit, they're going to be looking at your facility as a whole. Not only have you complied with the executive order, social distancing and the cleaning, but, what are your PPE stores, and are these things available? The fit tests for the masks. We're getting lots of issues or OSHA calls regarding the N95. And if they were used, was a proper fit test done, which is actually more complicated. I've recently, over the last several months, I thought, the mask fits, it fits, right? No, it's a lot more complicated than that. I have since learned. So I think those are some of the things that we're running into, but you don't want to lose sight of making sure everybody is still following the rules, and not, my mask is down here, no one's in this big conference room, but when I go outside, I'm going to put the mask on. And if you're a manager or a supervisor and you see people violating your policies that you put in place, you have to make sure you're enforcing those, because everybody's looking at this. And if you get a COVID positive and they are then called in to talk to the Department of Health, and they're saying, oh, yeah, everybody walks around without a mask. You don't want to be in that situation.
Right.
Yeah, good point. And so, Rita, lastly, on that, I'm glad you mentioned work comp, Marianne, because, Rita, can you talk to some resources? A lot of times the work comp carrier has a lot of resources that you can utilize, and what other resources do you have available as an HR professional? You know, what should managers know they can get access to, and how do they do that?
So if you're not bombarded already by all of the emails from all of the services, you know, and I know we get a little fatigued by receiving all of this information that comes, but make it a point to actually read some of those, attend some of those sessions. Your work comp carrier probably provides you some written documents. There are seminars, there are hour-long seminars, there are half-day seminars, but pay attention, watch these things, listen. You're going to learn something. Everybody brings something a little bit different to each of their presentations. And I think it's very important to stay abreast of what's going on, the cleaning, the mask wearing, whatever else it is that you need to do for your center. It's important to stay on top of what's changing. Just as all these leave laws have changed, a lot of other precautionary things have changed as well, and you want to make sure that you stay on top of these topics.
Well, thank you for all that. And looks like we have about a minute or a couple minutes to go here in our allotted time. So Marianne, any last comments and thoughts as we wrap up here today's session?
Look, you know, the laws are constantly changing. This could be overwhelming to a lot of individuals who are trying to navigate in unprecedented times with constantly changing laws. My advice would be, don't get yourself overwhelmed, don't panic, don't live with the anxiety. You know, reach out to, you know, your consultants, your lawyers. They will help navigate this for you. There are great resources online, whether it's the CDC or the Department of Labor. But if you look at it, you know, in a step-by-step process, you can tackle it, you can overcome it. You know, it's doable. I know that when we throw a lot, even this program, right? We touched upon so many different things, and it can seem overwhelming. You just want to throw your hands up. But I can assure you that you are not alone. Everybody else is dealing with this. And we would anticipate that a lot of the regulatory authorities we not only anticipate, we've seen it, know that this is, you know, new, and they are giving some leniency or latitude as people try to navigate this. So that's my words of advice to leave you with for today.
Terrific. That's great, Marianne. Thank you so much. And Rita, what are your last comments?
Same thing. Be forthright with your concerns, with your questions, with your comments. Ask. There are tons of resources. I'm a big believer in the checklist fashion too. You know, did I consider when we talk about leaves, did I consider PTO, FMLA, any state leaves, you know, on and on and on. If you have a little checklist to just go by, you know, we help employees, managers with this all the time, but use those. I mean, they're there to help keep you calm. And there's no need to, as Marianne said, panic. You have resources available. So.
All right. Well, thank you. And thank you all for attending today's session. On behalf of Marianne, Rita, and myself, thank you very much. I hope you have a great rest of the symposium that Garfunkel and Wild has put on. It's a terrific opportunity for all of us to learn something, and we appreciate your attendance. Thank you.
Thank you.
Thank you very much. Bye-bye.
Bye-bye.